Hi everyone, it's Teresa. This is the lecture for Chapter 23, all about your eyes, your ears, and the operating microscope. So the first slide talks about the eye and the ocular adexna and the codes there contained therein. The terminology is so very important. The code descriptions may vary only slightly, so that's why you have to be so careful when you're reading these. This is a great illustration. It's on page 612 with 3 other illustrations that are equally informative, and I would take a few minutes to look at those, just because they're going to be helpful. Remember also that there's a lot of bundling that's involved in this section. We want to make sure that the codes, remember that the codes are divided anatomically. So of course anything that's involving the eyeball is not going to be on the conjunctivis set. So you need to make sure if you're the anterior or the posterior. Coding accounts for patients who have already been operated on. There's also very specific codes for reoperations. So you want to make sure to read all the details, and hopefully your doctor is telling you this. There's a lot of bundling. For example, the subheading posterior segment, it has prophylaxis category notes that include things like the following descriptors are intended to include all sessions in a defined treatment period. So if a patient is having multiple procedures to remove cataracts, those codes are going to be all in one series. So you need to read those carefully. The eyeball. So we have 3 different types of removing the eye itself. So the evisceration is the removal of the contents of the globe. Enucleation is removal of the eye, leaving the orbital structures intact. And the extenuation is the removal of the eye, adexnia, and the part of the bony orbit. You also may have codes that are associated with skin grafting. If we're doing this kind of a surgery, there well may be some skin grafting. And look at these codes. These are not in our 65,000 series. So you need to make sure to know whether or not an implant was inserted, or a bony orbit was removed, or a muscle flap was performed. Removal of the foreign body. There's extensive notes. The removal can be from the external or extraocular. There's illustrations on page 613 showing this surgery and showing the slit lamp, the microscope with the high intensity light source. It focuses that long narrow beam of light, and it's different codes for with and without the slit lamp, and there's a good example here. The cornea. The anterior segment includes the cornea, the anterior chamber, anterior sclera, iris, lens, interocular lens procedures. You need to pay attention to all of those. We're going to break each of these down. The cornea, carioplasty, is repair of the cornea. Penetrating carioplasty is the full thickness of the cornea is removed and replaced with a donor cornea. Aphasia is the absence of a lens of an eye, and then pseudoaphasia is presence of an artificial lens after cataract surgery. The anterior segment, the anterior chamber, one of the procedures that we do is a paracentesis. We know that means removal of fluid. A needle is inserted into the anterior chamber and fluid is withdrawn. Usually this is to do like a biopsy, looking for a cancer. There's another surgical procedure using gonio lenses to view the eye. This is usually for congenital glaucoma. And then removal of these adhesions. They can be adhesions of the iris to the lens or the iris to the cornea. The quick check, number 22.2, is a great matching exercise that will really help you. Also, just a note on the 65820, in your CPT book, there is a note about using the modifier 63 on infants that weigh less than 4 kilograms. So you want to pay attention to that one also. Another anterior chamber code, it looks like Latin to me. So this is telling us it's involving all the trabecular meshwork, the iris-scalar junction. It drains the aqueous humor. The surgery reshapes or punctures the meshwork as a treatment for glaucoma or trauma. Excisions of lesions are accessed by incising the conjunctiva. Then we have the iris and the ciliary body. The iridectomy is performed for the removal of a lesion. This is the most common code, most common procedure that you will have done. But they also treat glaucoma this way. So there's many ways to treat glaucoma, and so that's why it's so important that you read very carefully to each one of them what was the procedure they did to treat that glaucoma. They can use a laser to do this endarterectomy or photocoagulation. So you need to make sure that you're reading very carefully as to what we're doing. Glaucoma is going to be a common reason for all of these things. The most common procedure in all of this section, according to Medicare, is, of course, removal of cataracts. So we have a couple of different kinds of cataracts. Listed on our slide is a nuclear cataract, which is the most common. It's in the center of the lens, the nucleus, and it's due to the aging process. This can also be called a senile cataract that appears as a patient ages. A cortical, it forms in the cortex and extends outward, and this is really common in a diabetic. A subscapular, capsular, can't even read, cataract forms at the back of the lens. And these are codes are assigned based on the type of the procedure performed, whether it was ICCE or ECCE. So we're going to talk about these just a little bit more. So the removal of the lens placement, the ECCE, the extracapsular cataract extraction, is a partial removal. It removes the hard nucleus in one piece and the soft cortex in multiple pieces. The ICCE, intracapsular cataract extraction, is a total removal. It removes the lens and the capsule in one piece. And then another type of extraction is photoemulsification. A small incision is made into the eye. Introduction of a probe, high frequency waves fragment that cataract, and then the lens is placed through the same small incision. The posterior segment, these codes include going from 67,005 to 67229. They include the vitreous procedures for the removal of vitreous humor from the eye, repair of a retinal detachment, which is the most common one you hear about, and destruction of a lesion of a retina or corroded. The extraocular muscles, this stratumus surgery corrects the muscle misalignment. So you have muscles that go from side to side, move the eye from side to side. Those are called horizontal. Vertical muscles move the eye up and down. The codes are divided on the type of repair and the number of muscles repaired. It can be one or it can be numerous, so you need to read those very carefully. Procedures on the eyelids. So we can have an incision into the eyelid to drain an abscess. We can have, I'm not even going to try to say that one, a repair of the eyelid. And these codes are all in the integumentary system. And then there's codes in the eye and the ocular system. So the selection of the code depends on the technique used for the repair. When you're talking about eyelids, they will give you you will have to make sure you're using a modifier. They're going to tell you where it was located. Is it the upper left, the lower right? You're going to use these E1 through 4 modifiers, Hicks-Picks modifiers, to fully describe the location. Only if it's applicable, though. Exercise 23.1 does not use any of those and talks more about the left and the right. Now we're on to the auditory system. These codes are divided by the external ear, the middle ear, the internal ear, the temporal bone, middle fossa approach. Outer and middle ear function is the conduction of the sound waves through the ear. Inner ear contains structures that receive auditory waves and relay them to the brain. And then the last part of this is the operating microscope. We've seen this many times before, but we're just talking about the application for it in the audio system. There's a great illustration. It's on page 617 in your book, and it shows the external, the middle, and the internal ear. The auditory system is for the divide upon the procedure. Are we excising, incising, removing a foreign body, repairing, or other? The external ear, most common, is an incision, a drainage of an abscess or hematoma, a simple or a complicated one. An excision is a biopsy of the external ear, external auditory canal, excision of external ear, partial or complete. You can have a growth. It's called an exostosis, is a bony growth of the external auditory canal that's also known as surface ear. Why? Because it's associated with chronic cold water exposure. Removal of a foreign body is based on whether it's with or without general anesthesia, and impacted serum, and you can do irrigation or lavage, and you're going to pay attention if these are bilateral. You have to add your modifier 50. Are you using an instrument or you're not using an instrument? That's going to make a difference. A lavage is an ear wash. Instrumentation is a serum removal. We talked about that one time before. We can do repairs, otoplasty. Otoplasty is for protruding ears. It may or may not decrease the external ear size, and you need to add your 50 modifier for both of them. Your middle ear codes, this is putting in your tubes. The fluid collects in the middle ear, and when the tube malfunctions, and it prevents air from entering the middle ear and pressure builds. So most of the time this is done on little ones when they have had many ear infections. This is really a confusing section in your CPT book, and you need to make sure that you're going to pick your code based on the type of anesthesia. So it's going to make all the difference in the world, and that's the defining factor. On the middle ear, the procedures that we can have can be for a reconstruction of an external auditory canal. Codes are based on stenosis or a congenital defect. Now you need to be cautioned because some of these procedures are bundled into some middle ear repair codes. So read those very carefully. The inner ear, you have incisions and or destructions, a labyrinthectomy, surgical incision into the cave-like structure, the labyrinth of the inner ear. If the pressure is building within the labyrinth, it can result in vertigo, ringing, hearing loss, etc. And the code for a transcanal procedure is 69801. And other excisions are labyrinthectomy, incisors and stapes are removed. Codes are based on the approach, and so you need to read those very carefully. Your introduction codes. We can put in a cochlear device implant for someone who is born deaf. We now do them on children. It's a computerized device. It restores partial hearing. The receiver is placed on the outside of the skin behind the ear over the side of the transmitter. The transmitter is implanted under the skin. The sound processor is connected to an electrode implanted in the cochlea. The figure, figure on 2312 is really helpful, and it really explains it very, very well. Our temporal bone middle fossa approach, surgical approach, is used with repairing the nerves, decompressing a facial nerve, decompressing internal auditory canal, and removal of a neoplasm from a temporal bone. This is also used to excise acoustic neuromas. So you need to make sure you're seeing exactly what we're doing here, and then we'll know exactly what approach we're using, and that's the way you're going to find your correct code. And then the last part of this section is about the operating microscope, used with procedures using microsurgical techniques. Code in addition to the primary procedure performed, unless the primary procedure description includes microsurgical techniques. The example is 15759, free facial flap with microvascular acetomosis. Note that the following has the statement, do not report 69990 in addition to the code. So you just need to read those notes carefully when you're using an operating microscope. It clearly states whether it's a billable service or whether it's going to be bundled. Okay, that's it for Chapter 23. Good luck, everybody. If you have any questions again, feel free to shoot me an email, and I'd be happy to do what I can for you. Okay?